Greetings from the Asian Productivity Organization Secretariat. Welcome to all viewers to this APO's Productivity Talk, a series of discussion on the topics related to productivity. We are now broadcasting this event live from Tokyo. So even though digitalization is already an essential part of healthcare sector itself has been among the slow adopters of technologies, particularly if one compares it with its counterparts, such as e-commerce or fintech. So according to some, this may be due to the perception on inherent risk of technological failure that may involve patients' life. But one thing for sure is that emerging technologies accompanied by the fourth industrial revolution will sooner or later transform the healthcare sector. So the widespread use of telehealth care, for example, health analytics and other digital health system based on emerging technologies has already been part of our life for quite some time, actually. The global pandemic has spread the use of such technologies even wider. So in this P-Talk, we will share a success story from Iran on the implementation of a hospital management system called Hospital Intelligent Management or HIM system to increase hospital productivity. HIM itself, bolstered by digital technologies and automation, was developed to improve the quality of the healthcare services. And of course, its productivity through the provision of adaptive, innovative, affordable healthcare services. So it has been proven not only that the system can streamline the healthcare related activities and operation, but also to increase the productivity of the healthcare givers or providers. So adoption of such tool can save lives and increase much needed productivity at the time of global public health crisis that we are facing these days. So to discuss about this success story, we are joined today from Tehran, Iran, by Dr. Alireza Zali. So good afternoon from Tokyo, Dr. Zali. We are glad to have you here today in this talk.
Thank you, sir. Good afternoon to you and your colleagues. I would like to take opportunity for express my heartfelt special thanks to you and your colleagues for providing this opportunity for me and my colleagues in the SPMU Shahid Medical University and also my dear colleagues in the National Productivity Organization in Islamic Republic of Iran. I'm ready for presentation.
Thank you so much, Dr. Zali. Before Dr. Zali start with his presentation, let me just reintroduce him again. Dr. Zali is currently holding a position as a Chancellor at Shahid Beheshti University Medical Sciences. He is also a neurosurgeon and Chief of Functional Neurosurgery Research Center at the same university. He is a distinguished member of various medical profession associations and also academic organization in Iran and abroad. He has authored and co-authored of around 300 articles and papers in medical science, both in Persian and English. Last but not least, he's also among the prominent figure in the development and also in the implementation of HIM system in Iran. So before Dr. Zali start with his sharing, I would like to inform all viewers that today's sessions will be live and interactive. So I'm inviting all of you, the viewers, to leave your comments and questions in the live chat below. So Dr. Zali, you may please start with your sharing.
Yes, thank you. For the first slide, I put this slide for the beginning of my presentation. It is the official statement of the WHO. On the basis of this statement, improving health outcomes depends on data that is available, timely, actionable, and reliable. Health data needs to be collected, stored, and shared transparently and analyzed, both on the foundations of the strong data governance. You know that evidence-based management is the crucial manner for the increasing of the productivity in all of the services, for example, healthcare services. Manager of healthcare organization needs reliable, timely, integrated, and comprehensive information for increasing the quality and productivity of health services and make evidence-based decisions. You know, Shahid Beheshti University of Medical Science is one of the biggest and most established medical university in Tehran province. You know, in Iran, we have a unique system in national health system that is integrated medical and education and health services. On the another hand, the medical university in our country, apart from educational and research affairs, also responsible for health provision. On the basis of this structure, our university has 20 affiliated hospitals that includes 10 teaching hospitals and also 10 therapeutic non-teaching hospitals. HIM that you mentioned about this system is fully designed and developed at university. Actually, it is a comprehensive and integrated decision-making system for healthcare business intelligence and also the performance information of different hospitals, including 20 hospitals in our country, in our university, and standardized from 12 databases. And in the next slide, I will describe about these 12 databases. On the other hand, comprehensiveness, accuracy, and timeliness of the information is a unique feature and outstanding feature of the HIM. On the at the starting points for the developing and establishing HIM, we analyze the pitfalls and drawbacks for managing of the hospital in our university. On the basis of these analytical approaches to the drawbacks for the management of the hospital managing, 70 process and 161 some process in hospital were standardized. For example, in the emergency department, 80 sub process has been organized, has been standardized. On the other hand, in the operating room process, about 21 sub process has been standardized. On the other hand, for the standardization and synchronization of the data, about 9,600 medicine and 82,000 medical supplies were done at the university, and the process at present is still ongoing. All hospital information in the university headquarters were standardized and integrated into the firm of a central service as the heart of this HIM system. Data warehouse that at the university level, you know that in business intelligence, data warehouse has a pivotal role for the organizing the information. We strive for achieving the goal first is improving service, improving productivity. That is the main theme of this conference, increasing patient satisfaction. And on the other hand, because of the about 50% of our hospitals are medical education, so places improving quality of medical education for our students and also other persons. I mentioned in the previous slides about 12 already established different information system. For example, staff attention system, financial management system, and other. At the first steps, we integrated and also in aggregation of these softwares and also system, and finally, at the final command pathway, HIM has been produced by synchronization and also integration and aggregation of these 12 different hospital information. You know, Because of these features, we have opportunity for providing HIM as a tool for this decision supporting and also decision making system in our university. In this slide, four outstanding features of HIM has been displayed. In the left of a slide, the live, for example, live hospital live dashboard, bed live dashboard, patients live dashboard, medicinal supplies live dashboards, and also we extracted key performance indicators for the HIM features. And after extracting the KPI, performance reports, performance portfolios, and a specialized dashboard has been developed in the HIM system, and also because of the electronic-based medical records, clinical information of the patient records, and also financial information, and PACS, that is abbreviation of the archiving, picture archiving and communication system for the teleradiology has been provided in this system. And the final attesting feature of HIM is the insurance of the system with the direct connection with the insurance system in our country. We have facilities for the monitoring and audit system in the insurance system. For example, Iranian national health insurance system at present has a direct bilateral linkage with our system at the hospital level. I talk about the live dashboards. That is very important for the managerial aspects of this HIM system. You know that the KPI is the cornerstones of this managerial approach, and KPI have been developed in the 16 specialized dashboards. And in this specialized dashboards is the big picture of the actual real-time monitoring of the data and also the events in the affiliated hospitals. For example, in this slide, the main page of live dashboard and many of the items such as clinical admission, clinical emergency department status about the admission, the bed occupancy rate, the surgery status, the surgical aspects, and other crucial information are available in this main page. About each 30 or to 5 minutes, the information of the dashboard, live dashboard, will be changed. And on the other hand, at present, actually, the HIM provides for us a ever-changing tools for the dashboards. For example, you can access to any records with the ethical considerations and also privacy. For example, in this slide, you can see the patient with the vascular problem, the pathologic report, and from the specimen that has been done in the surgery, we can access to the patient record for the research, for the monitoring, and for the therapeutic measures about this patient in one of the hospitals in our university. In patient live dashboard, that is very important dashboards, and in this system we have access to many data, many information. For example, the occupancy rate and empty beds, and also it helps to us the centralized approach for managing the beds at the university headquarters, and for distribution of patients, particularly at the emergency setups. It is very good opportunity for the changing the patient at the inter-hospital changes. Many of information are available, and with the diagram and histogram, we can provide tools for the managing and also live monitoring of many occurred data from the hospitals, and at the managerial level in the hospital or the centralized setup in the university, we can provide it monitoring real time and on the basis of the information. KPI dashboards very important for the HIM and also for the build up HIM and also the continuing advantages of the HIM. I summarized the dashboards on this categorization: physical resource management, such as beds and medical equipment; human resource management; financial management, for example, physician balance, commercial and financial balance; department balance, and hospital balance; and also 10 KPI dashboards. This is the main page of the KPI that I mentioned about this, and many of the crucial, important information would be ready and also actionable and affordable for the managerial system in our university and also at the hospital level for the monitoring and also changing of the strategic planning for the increasing productivity at the hospital level. For example, operating room dashboard. You know that the operating room are very important in the hospital because of the many of the financial inputs have been driven from the increasing of the productivity at the operating room. For example, in this dashboard, you can see the total number of the operating room in our university, total number of surgeons, total number of anesthesiologists, and also the utilization rate of surgical unit at the hospital level and other. You know that on the basis of this CPT, that is the official logbook for the purchasing and also for collecting and accounting the price in the hospital, at the hospital, that is non-California system, we have a key point that Ka. Ka is the unit, and you know you are familiar with the RVU, relative value of unit. On the basis of this CPT system, that is a worldwide system for accounting the prices of the services in the health system, we can calculate it, for example, for each surgical unit at the hospital for providing and also for collecting costs as the tool of the common financial tools. Is the emergency department dashboard. On this slide, you can see the actual status of the emergency department dashboard. For example, in the bottom of the slide, you can see the time. For example, time globally at your university was calculated about 9 minutes from the emergency department attendance of the patient and also the first specialist visit, and other parameters have been displayed in this dashboard. Medical equipment dashboard is very important for us, and for example, for managing of the medical equipment at the university headquarters, we need the actual real-time information about the status of the medical equipment at the hospitals levels. And in this slide, you can see the distribution of medical equipments and the actual state of the equipments at the hospital levels. As you mentioned, the COVID-19, at the beginning of the COVID-19 national crisis in our country, we overdrive a new dashboard, live dashboard on the HIM system for access epidemiologic information related to the rate of infection, suspected case, hospitalization, and unfortunately deaths. And in this dashboard helped to us because of at the Tehran metropolitan system, we provided the actual epidemiological strong evidences for the managing of the COVID-19 in Tehran province. For example, prevalence, incidence of the COVID-19, and also geographical distribution of the different zone in the Tehran province has been provided by this dashboard. Actually, the ultimate collected data in this live dashboard, at the end of day, we provided the accessibility to this dashboard for the manager of the Minister of Health and Governance and other stakeholder for combating COVID-19 crisis in the Tehran province. It's one of example of the drug stores and drugs categorization for the therapeutic measures at the hospital, for example, emergency departments, wards, and also ICU and special wards that has been presented the patients. One of the established dashboard that has been changed dramatically in recent generations has drug and medical supplies dashboard, inventory management, reorder point, and inventory surplus, consumption management, and forecasting has been provided with this dashboard. Pharmaceutical strategy purchasing based on the ABC and supplies portfolio analysis. Identify patterns of drug use based on the anatomical, therapeutic, chemical classification system that the abbreviation is ATC. Inter-hospital medicine and medical supplies exchanges, strategic supply of specialty drugs for epidemics such as COVID-19, and in the hospital, improving pharmacies' efficiency for providing the drugs. This is a dashboard from the drug record, and many of the information can be occurred from this dashboard at the hospital and also central offices of the university. For example, on the basis of the anatomical geographical distribution of the drugs and their composition, for example, in this dashboard, you can see the, for example, about 60% of drugs in our university in the 20 hospitals have been used for the gastrointestinal tract disorder. On the other hand, for example, the percent of drugs contribution in the cardiovascular problems is more profoundly and more the quantity of the drugs is less than the nervous system and other drugs for the nervous system. In this slide, you can see the supplies management on the basis of the total drugs, the total price of drugs, the stock status in the hospitals, and also the pharmaceutical maneuvers that could be done on the basis of these dashboards. I mentioned in the previous slides about the opportunity and facilities about the inter-hospital exchange. For example, you can see the actual stores in the hospitals, and we can, at their centralized setup, we can exchange drugs. For example, albumin in one hospital is scanned, and on the other hand, another hospital that is affiliated to our university has sufficient amount of albumin, and we can transfer from the second hospital to the first hospital for the providing. And with this system, on the other hand, the drug shortage has been decreased and declined in our university because of this system, inter-hospital exchange. Two important dashboards that have been added to the HIM system is the patient satisfaction dashboard. Various dimensions of patient satisfaction in the field of 15 features of hospital services are available on the basis of the patients' talks, patients' feedbacks, and other actual interactive system with the patients. And also clinical quality dashboards, safety-related indicators, including medical errors, newer events, RCA, that's abbreviation of root cause analysis status. RCA means the process-based solution and also analyzing of the inevitable and also the complications and bad events at the hospital. And at the first in the hospital, the RCA team analyzes the process and also the main aspects of the this event. And then at the university headquarters, also we review the RCA reports, and also we reanalyze the reports. And also compliance with the clinical guidelines have been considered in this dashboard. This is a clinical quality dashboard, and many of information can be occurred from this live dashboard. This is the patient satisfaction dashboard that I mentioned. About 50 features have been organized in these dashboards, and you can see over in this dashboard many of the, for example, in this slide, you can see the satisfaction rate of the patient about paraclinical services is about 80%. We provided balanced scorecard for all physician, specialized group, faculty members, diagnostic and treatment department, and hospitals. Scorecards are prepared systematically and sent privately for the faculty members, for physician, specialized group on the basis of monthly order. At the first generation of the HIM, we provided the mobile platform application, and at present, mobile application of HIM dramatically increased accessibility. Physician in any time and anywhere can access information with utilization of mobile phone and a smartphone on a secure platform. Notification system is very important, and feedback is very crucial portion of the HIM system. Actually, with this notification and smart alert, we can monitor and also audit the system, and also with the sending direct feedbacks to the head of the hospital and also the faculty members, physician, and all of the members of the hospital. We can increase the productivity and also increase the performance. In this system, immediately inform the managers about critical hospital events with SMS, email, and also some smartphones advantages. For example, maternal deaths is very important for us, and if the maternal death occurred in the hospital, in each hospital, immediately the managers in the hospital and also at the university will be alerted about this event. Infant deaths, newer events, and medical errors. In this slide, I will summarize the main achievements of HIM. The first is the increasing patient-centered care, conducting applied research in the field of medical sciences, and also applied research is very important in the health system, and also with the linkage of the demands and requirements at the hospitals, and also the information with the researchers in the hospital would be very good opportunity for applied research. Improving construction and development of hospitals, equitable distribution of human resources and medical equipment, because of the distribution of human resources and medical equipments has a central aspect at the university level. Management of supply, distribution, and consumption of drugs and medical supplies. Centralized appointment scheduling for outpatient clinics. Improving faculties members promotion process with the direct feedbacks and also notification system on the monthly basis. Improving performance of emergency operations center. For example, some achievements have been displayed in this slide. For example, at the end of year, after establishment of this system in the 20 hospitals at university, about 25% cost saving on drugs and medical supplies have been occurred. 2030 performance improvement, especially in the operating rooms, increasing the turnover operating room and increasing utilization rate of the operating room, and also the increasing produced car on the basis of the CPT system in the operating room, and actually ultimately increasing of the performance and financial outputs in the university. Also, 25 increasing clinical service quality, 9% reduction in patients' average length of stay, and increasing acceleration of turnover of the patients, and decreasing of the hospital stay, because the decreasing of hospital days, apart from the financial advantage, also would be optimized for patients. For example, decreasing of hospitals acquired infection, and also some hospitals acquired hazards such as emboli, the event thrombosis, and co-current problems at the prolonged hospitalization. Also, 70% reduction in emergency department first visit delay, and other advantages. We have opportunity for presentation this HIM at their 44th World Hospital Congress that has been occurred in Barcelona 2022, and as a best practice in using and integrating information technology for improving the quality and productivity of health services. Benefits of this system for our health system, I think, with consideration of the achievement of using the HIM in our university, the establishment of this system in all hospitals in Islamic Republic, in the nationwide, could improve the quality, safety, effectiveness of health services, increase the efficiency of health system resources, and also augmenting the health system with evidence-based decision-making and resource allocation optimization, increasing organizational transparency, increasing the quality and effectiveness of the organization's services, improving efficiency of corporate resources and teamwork, promoting the culture of productivity at the healthcare system and healthcare provider is the benefits of this system. Thanks again for your attention, and I would like my presentation would be helpful for you. I'm ready for the comments and also question of your dear viewers.
So thank you so much, Dr. Zali, for the presentation. I think it's useful if it gives us what's happening, what the things that actually healthcare can do to improve their productivity and efficiency. At the same time, having their services to be delivered in a better way. So I would like to thank you again for that, Dr. Zali. So I would like now to move on to the Q&A session. I would like to pose some question to you, so then the viewers, those who actually watching this or will watch this later, can take benefit out of this talk. So the first question, Dr. Zali, is that what was actually the primary motivation in the development of the HIM system? Were there any specific challenges that need to be overcome, such as the hospital wanted to increase the satisfaction of the patient, those kind of things? If you would like to explain that further to us, that would be appreciated. Dr. Zali, the first question.
I think the most important triggers for us is the low productivity status at the hospitals, and we were facing with several problems, such as issues of patient satisfaction, and also with our health services at the hospital levels, low efficiency of human resource, physical resources in the hospital, and also irrational use of drugs and medical supplies. Because of these problems and these challenging issues, we provided this system on the basis of the primary reasons. I think the primary reasons actually were categorized on these problems, particularly the low efficiency system and also the low efficiency of the resources at the hospital.
Okay, so it was to increase the productivity is one of the main motivation in the development of the system. So the next question is coming from one of our viewers, Sato Suzuki. I believe that the person is from Japan. The question is about how how much the total cost of the development and maintenance. That's one, and then how many resources were required in the development. Dr. Zali.
Uh, Total cost of development and maintenance in this building and also the maturation of this system, because on the sequential manners and also the different phase based of this development depends on the phase of the building up. At first, the total cost of development and maintenance is from our financial resources at the university. I think about 20% of our current budget in the university totally has been allocated for the developing of and maintenance of the system.
Okay, so how long the system was developed, and who developed it actually, and then since when it was implemented?
I mentioned previously this building up and designing and also constructing of the system and development of the initial versions, and then stabilization of the system, and also the adding their and updating their next generations of the system took about 1 year. IT specialists at the university and some from the other departments designed their first version of this system in collaboration with the university staff and hospital operation staff, and also the productivity committee that has been exists at the hospital and also at the university levels. The system was put into operation about 3 years ago. Since 3 years ago, the system has been implemented and launched in the managerial system of our university.
All right. So actually, if we take a look around, there are quite a number of similar systems in the market that we can find similar to HIM. So what make this HIM different or perhaps better than other system, Dr.
I
Zali?
think uh, at the national level and on the basis of the nationwide survey in our country, I think the HIM system in the health system at the hospitals, at the hospital levels, and also university and at the Ministry of Health, I think this is the unique system. And in comparison to other previously versions, the features of the system is unique, and also I think these features is not comparable with the traditional versions of the system, and I think it is the most important advantage of the HI system. On the other hand, actually, in direct linkage and integration of the healthcare information with the data, and also purification of data, evidence-based information, I think the system in our country at present actually is unique, and I think the actual market is not a very strong competition with our versions.
Okay, the next question is coming from viewers, the same viewers, Sato Suzuki. This is asking about, is there the medical devices are connected to the HIM system? Dr. Zali?
What I see, I will see the question. It's a short
So
part
let
of
me let,
yes,
let me
yes,
repeat. Just this is perhaps
yes.
this is another question from Sato Suzuki, and the
Yes,
person asking whether the medical devices are connected to HIM system.
yes, 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 yes.
Okay.
Actually, it is a short part of smart healthcare, and information about medical supplies, medical service devices, and drugs are connected to HI system on the basis of the soft part of this smart healthcare system.
All right. So thank you
For
for that.
example, PACS is an example, picture archiving and communication, and on the basis of the PACS facilities in this system. Many of the pictures, radiological imagers, and all reporters are available in this system.
Okay, thank you. The next question is about I think HIM system itself is being used for 20 SBMU affiliated hospitals, if I understand it correctly. How much is the coverage of the healthcare services that these 20 hospital can provide in Iran, and any plan to extend this system to other hospitals, do you think?
Yes. On the basis of their unique structure of the Shahid Beheshti University of Medical University, at present, the catchment area that we are responsible for health care provision, such as preventive measures, therapeutic measures, out about 6 million population at the Tehran province, particularly in the northern and eastern portion of the Tehran province, and our university covers a large part of the population of the Tehran University. In Iran, at present, about 1,000 hospitals are actively providing the therapeutic measures for the peoples. Project of establishing this system, the Hospitals of Islamic Azad University, that is another university in Tehran, is being carried out by my staff, my colleagues, and our technical staff in our university. Fortunately, at present, improving productivity is one of the priorities of the Minister of Health and in Iran, and I think the grand work is being laid for establishment of the system in other hospitals in the country. On the other hand, actually, our university is fully prepared for this purpose.
Thank you. The next question is about the challenges that perhaps it was encountered during the development of the system. What were the challenges, if you could explain to us, and then what the issues in the implementation of the system, and how those issues are being addressed?
Designing an integrated integrated and standardized coding that I mentioned in the previous slide, for all processes and also procedures, drugs, and supplies in the hospital, and apply uniform coding in all hospitals was a significant challenge and critical issue for us that was made possible by continuous hard works and also by our teamwork. I think the validating of data and creating dashboards with the correct information, reliable, attainable information, required a change in how data was recorded at the periphery site, which was made possible by training, empowering, and monitoring employee performance.
Mm-hmm. All right, I would like to know more about the inclusion or the integration of COVID-19 live dashboard. How it was integrated into system? I believe that because there was a need to do that. So if you could explain further to us how it was integrated, and how fast was the process of integration was done, and then perhaps the next question after that is how effective was the HIM help in the management of the COVID-19 pandemic? Dr. Zali.
Actually, the managing of the COVID-19 as a national and international pandemic crisis, we need the reliable information and evidence-based data for the managing of these problems. On the basis of this, access to epidemiological information such as the incidence and prevalence of and also the rate of infection and monitoring of the daily and weekly changes of trends of the COVID-19 at the provincial in our system. For this purpose, patient information has been gathered from all of the hospitals that were engaged at the combating of hospital for the COVID-19 patients. About 2 months after the uh, initiation of national crisis and the first announcing of the COVID-19 crisis by the Minister of Health, our system were ready and it launched a new version and a new dashboard for COVID-19. Acquisition of the data were provided, and with overdriving this dashboard on the platform, mother platform of the HIM, we up-to-date monitoring of the patients and also trends increasing or decreasing, and all of the parameters that were mandatory for managing the COVID-19 crisis were available for us.
So the next question is coming from one of the viewers, Mr. Sohail Mizani. I think he's asking about whether the introduction of the system can actually reduce the cost of the treatment that the patient needs to pay to the hospital.
Yes, directly because of the actual information about the drug management and also medical equipment supplies, and also one of the features of the HI system is the fitness of the clinical guidelines with the patient's requirements. On the other hand, indirectly, because of the decreasing of patient stay in the hospital, has a very important role for decreasing of the cost of the patient pays. On the basis of the calculated informations, about 10 to 42 decreasing of the total patient's pay. On the other hand, I think the HIM and other smart healthcare system can provide decreasing of the out-of-pocket for the patients, because the system actually is inpatient, and because of the on the other hand, with the direct feedback and notification to the faculty members, to physicians about the financial management, I think we have opportunity for the changing the attitude of the providers at the hospital level.
My next question is basically about the impact of this HIM system to the medical staff. I'm asking about their motivation, perhaps their happiness. Is there any such an effect or impact of the implementation of the system to the medical staff? Are they now being feeling more satisfied, for example, with the services that they deliver? Are they now being happier in giving the services because because of the health of the system? Dr. Zali.
Yes, I think for medical practitioner at the hospital, there is a crucial requirement for the direct feedback system to the medical practitioner and also healthcare providers for the manners and also the disadvantage of the works and also complications and also errors, medical errors and other events. I think because of the HIM has a crucial role for providing feedback system to the directly and privately to the medical practitioner, I think this system could provide opportunity for the healthcare providers. And I think because of the equitable allocation of medical equipments, I think on the other hand, this system, on the other hand, has been provided the justice and equitable distribution of the medical supplies and medical equipments. And on this indirect basis, I think also there are some satisfaction of the healthcare providers.
This is my last question that I have, which is mainly about your advice. What would be your advice to hospital managers in other APO members who wants to improve the delivery and efficiency of their healthcare services? So should they also develop similar systems such as HIM? Your advice, Dr. Zali.
I think integration of information technology and specialized knowledge and management in the field of health services can greatly help improve system performance. Actually, a HIM system is a performance-based augmentation of efforts at the hospitals. Our recommendation is to develop the use of a smart system in the health sector. But I think the most important feature of the HIM system is the dynamic inherently in the system. And I think this adding and also updating the generation at present in our university, we are launching the sixth generation of the HIM system. I think this dynamics of the information and also correcting the drawbacks of the system would help to the healthcare providers.
So with that, I would like to thank once again to Dr. Zali for the sharing. I think it was really a good sharing on the way to increase the productivity and efficiency in hospital. And on this particular session, we are focusing and referring to the case or the best practice in Iran. So with that, the session is going to end. But before that, I would like to thank to the viewers for their engagement. If you still have comments and questions, please leave them on our YouTube channel, and we will try to get back to you as soon as we could. Even after this session finish, we can still have the response offline, of course, from Dr. Zali on the
Thank
question
you.
and the comments. I believe that Dr. Zali will be very happy to provide
Thanks.
us with that answer. Once again, I would like to express our gratitude to Dr. Alireza Zali for sharing the time and your valuable experiences with us. If you would like to all viewers to receive updates on the future APOP talk and any other updates related to APO, please subscribe to our YouTube channel. With that, I would like to thank everyone, and we'll see you again in the next APO productivity talk. Thank you and goodbye.
Thanks. Thank you. Good night.